welcome to the Let's Talk Kids Health Facebook Live Show, episode 52. I'm Dr. Narissa Bauer, your host. I'm a behavioral pediatrician and CEO of Let's Talk Kids Health. As you know, the concept of this show is to share information about behavioral health, parenting, and family wellness. Each week, I plan to bring you topics and guests to help me advance this mission so that we can all talk together. Now, let us know that you're here by commenting, asking questions, and liking this post at any time. And in a little bit, you can ask questions of my guest. The replay will be immediately available after the broadcast. So if you're watching this and you're thinking, so and so this would be really great for them, please share because sharing is caring. Now, if you don't want to miss future episodes or maybe check out the past ones, subscribe to my YouTube channel, Narissa Bauer MD, and follow my blog Facebook page, Let's Talk Kids Health. You can always join my free parenting discussion group. Okay, so now on to this week's guest. Dr. Nilong Vyas takes your personal parenting goals into consideration when she formulates a plan for your family. She is knowledgeable not only of the common sleep approaches, but more importantly, has a pediatric medical knowledge base. Her patients and clients adore their sleep doctor because she considers everything when giving advice, knowing that sleep is not a solitary issue, but intimately involved with the child's diet, development, day-to-day schedule, and holistic well-being. I am so excited to be chatting with her today and about everything sleep because, we all need good sleep. So welcome to the show, Dr. Vyas.
Thank you so much for having me. It's an honor.
Yes, I'm so excited. And gosh, we've been planning this for a long time. So I'm glad we were able to connect and make this work. I like to kind of start at the beginning and talk to you about, what exactly is a sleep consultant or a sleep coach? I mean, I know that you're a pediatrician by training.
Yes.
So if you can kind of talk about that intersection, how that came to be.
Yeah, so that's a great question. So sleep coaches help families who are having trouble getting their children falling asleep independently and staying asleep through the night. So I specifically focus on the individual needs of the family, their specific parenting style, and target a plan that fits their lifestyle. But more importantly, I base my recommendations on the developmental needs of the child because my pediatric medical training and research. So it's a behavioral modification approach that takes the whole child and family into consideration. And, there's no shortage of information online, and parents are, scouring the web all night long. And although it's great to have that resource, it sometimes can be confusing and contradictory to navigate through all of that information and apply it to their specific situation. So I help devise a plan that makes it simple and easy to follow to get their child from not sleeping independently to sleeping independently through the night.
Yeah, I looked at your website, which we'll talk about later, but I saw like in big words, do not Google, which is so true because anybody can post on there,
Yes.
and it's so confusing. I mean, I do a lot of parenting book club and there's so much great information out there, but then it's so hard to kind of filter through and kind of pick and choose. So having someone like you with your training and background to really tailor a plan, is invaluable.
It is invaluable. And I think, parents get let me just, ask a friend or ask Google, and you get little bits of information, and parents may try that for a day or two and they're like, okay, this is working. And then it stops working. And then they try something else. And then again, it works for a couple of days and stops working. And then they're left more frustrated and with maybe a worse situation than what they started off with. So it's
Yeah.
nice to just reach out for help and start right from the get-go, and it'll be less stressful not only to the family unit but the specifically the child that's
Yeah.
sleep difficulties.
Well, and we all know. I mean, we're both parents too, and we see
Yes.
kids ourselves. But if the child's not sleeping, nobody's sleeping.
No, it's
So
exhausting, so exhausting emotionally and physically. And then a lot of parents are working and having to deal with a child that's up all night long and then having to go to work. A lot of my clients are physicians and having to operate the next day or treat a family member, especially with COVID so rampant right now. It's really, the healthcare workers are so stressed that having a child also not sleeping well just adds to that stress. So even though it's a lot of work to get the child sleeping through the night, it's worth taking the time to do that so that everything plays out a lot better once the child is sleeping.
Yeah. So can we, sort of talk about that? I mean, I'm curious to know what are some of the more common issues that you manage?
Yeah, so most families reach out when their baby, who's no longer a newborn, is still waking multiple times at night. You expect that out of a newborn, but once a child is, 4 months of age or older, you expect them to start having longer stretches of sleep and ideally even sleeping through the night, like 12 hours through the night without waking for a feed. So if a child is still waking for a feed or waking multiple times at night, needing to be soothed or lulled back to sleep, a lot of parents are like, okay, you're no longer a newborn, but you're still waking up. What's going on here? I expect some of it maybe in the 4 month, 6 month, but once it gets past that, I think parents get desperate.
Hmm.
And so that's one of the times that they reach out. And often, too, if the child is needing multiple interventions to get back to sleep, so being rocked to sleep or lulled to sleep or held to sleep or fed back to sleep. And it's one thing if their child is just waking up once or twice at night, but when they're waking up every hour, hour and a half, every 2 hours, it can be really exhausting, especially even if they've had a little stretch of sleep where the child did sleep for a longer stretch and then they're starting to regress. I think that's when a lot of times parents are reach out for help because
Yes.
they're like, something's not right here.
Yeah.
um,
Yeah.
But I also get families who reach out when their toddler's no longer staying in their bed, either as a result of moving from a crib to a toddler bed, or because they were never good sleepers to begin with. And then
Mm.
sleep time and bedtime has just become more of a nightmare. And toddlers are stalling at bedtime. And then the parents expect, okay, bedtime is 7 p.m. We're going to go in around 6:30 and I'll be out of there by 6:45 or 7. And then it becomes 7:30, 8:30, 9 sometimes. And that the parent then loses all of their time in the evening to get their work done or spend time with their spouse or just kind of decompress. And so that multiple nights of that tend to warrant a phone call to me. um,
Yeah, I mean, those I remember those days, and
yeah.
I also hear and I feel for those moms or the parents who say, "Oh my gosh, won't fall asleep unless I'm constantly holding, or we have to get in the car and drive around, or and then finally they're sleeping, and then I try to put them down, then they're awake again." I mean, they're frazzled.
Yeah. And then when it's a toddler, it's a little more difficult because they're verbal often, and they're, mommy, don't leave. Mommy, I'm scared. Daddy, stay in here, and then it really pulls at your heartstrings because you're like, well, they're scared or there's something wrong. So let me just stay in here until they're asleep. And then I'll sneak out, which then creates this whole level of mistrust and distrust for the child. And then they really start to wake up multiple times overnight. So, whereas that might have worked in the newborn stage where you can just kind of hold them to sleep and wait till they're fully asleep. I hear parents say all the time, like, when they kind of go limp, I know they're asleep or their breathing patterns change. And then I put them in the crib or the bassinet and leave. And that works in the newborn stage. But once the child is around 4 months of age and becomes more aware of their environment and surroundings, that gets harder and harder. And any change in altitude, that shift in altitude from being held to placed into the crib or bassinet, and the eyes pop open and the child's awake and crying, and then you have to restart the whole process. And then it gets worse as the child goes into toddlerhood and is even more aware of their environment and surroundings and becomes verbal. So
Mhm.
that's again another time when parents reach out to me, is when the toddler isn't sleeping well, or if mom has a toddler not sleeping well and has realized that she's pregnant and knows that the newborn will be up all night, and then now the toddler's not sleeping well, as in addition
Yes.
to have two children or multiple children not sleeping well is exhausting.
Yeah, so you help in those cases too.
Yes,
Yeah.
absolutely. And I help with siblings often. There's two siblings, of similar ages that aren't sleeping well. So I help families with siblings, help just newborns, toddlers. I even work with older kids, school-aged kids who either never really kind of slept well, or something changed. There was a recent move or a new sibling, or something changed at school, and especially COVID's created a lot of anxiety in kids, and this fear of death and, needing the parents close by. And so a lot of times parents are like, okay, what's the harm? I'll just go ahead and sleep here with the child until they're asleep. And then again, like I said before, it creates this sort of mistrust, distrust when they do wake up overnight and realize the parent is no longer there, and kind of in a more panicked and anxiety ridden state, when they realize the parent is not there. And then it sort of is a downward spiral and they start having difficulties sleeping. So I've worked with, up to 10-year-olds and even adolescents who are having difficulty sleeping. So
Mm. How does that look? I mean, I'm just asking for families who are watching this or catching this on replay later. Like, how would that look like if it's maybe a preteen or an adolescent who has sleep issues? Would they work with you separate from the parents? Do you work with them both? How does that work?
yeah, so I would meet with usually the parent first, just to
Hmm.
kind of get a good idea of what's going on, and sort of let them know what the plan is, and then meet with the adolescent individually, and then meet with them combined, so that everybody's on the same page. Everyone's got a plan of action, and it doesn't feel like us against the teen, or the teens having to do this independently. So we're all as working as a family unit, together to achieve adequate results.
Hmm. And I guess, like we were alluding to earlier, there's so many different parenting approaches, sleep approaches. Uh, um, is it fair to ask you, is there like one size fits all approach? Because there's a lot of different approaches out there. I mean, how do you work with a family who might maybe, let's say, have differing opinions, or maybe do a different style than you know. Somebody else, like the babysitter or something, right? So
Yeah.
how do you reconcile all those differences?
Yeah, so I focus on the science of sleep. So, what the developmental needs of the child are based on their age. So, how much sleep they need, what time those, sleep timings should be to get adequate amounts of sleep, so that they're not incorporating a sleep debt. So based on that, we're establishing a foundation for what that child needs.
Mhm.
So once we discuss what the child's needs are and what the ideal schedule is, then I take the parenting styles into consideration, and we put into a practice a plan that fits that style. So and I also look at the parents' schedule and their needs, what babysitters, daycare, schools, all of that, activities, all of that gets taken into consideration when coming up with a ideal schedule for that family, so that
Mhm.
they're not feeling like there's no way I can fit into a 7 to 7 schedule, or, because we don't get home till 5 or 6. So I take all of that into consideration and formulate a plan that works for that family.
Mhm. I mean, just for the viewers out there, can you give us like a rough rule of thumb in terms of like what is adequate sleep for kids based on age?
Yeah, so ideally, until about 6 years of age, most kids need about 12 hours of overnight sleep,
Mhm.
uninterrupted sleep. Once they get about 6, you can go down to as little as about 10 and a half. And then in teenage years, as little as 8, but up to 10 hours of sleep. So
Yeah.
it's quite a bit of sleep, and most kids are not getting this much sleep. I know my kids will come home and say, so and so only sleeps, 8 hours, or so and so only sleeps 9 hours. We sleep way too long, way too much. And then, in the evening, he's like, okay, I'm tired. I'm like, we can stay up. Let's stay up till 9:30, 10. Let's see what happens. And he's like, okay, I'm tired. I'm ready to go. And it impacts their mood, behavior, their ability to eat well. Just, so many developmental changes are occurring in their brains, in the, especially from 0 to 5, but even after that, all the way through adolescence, that sleep is where all those neuronal connections get made. And, when children aren't getting adequate amounts of it really is a snowball effect, and it impacts everything.
Mhm.
And it's
Yeah.
hard. I know it's hard to shut everything down, especially when parents are working late. There's activities, there's, homework, there's social media, there's, devices, there's entertainment. There's a lot of things that families want to get done. in the evening time, and shutting all that down to go to sleep is difficult. It's difficult for everybody, but prioritizing sleep is so essential, because everything then ends up falling in place. Kids end up listening a lot easier. They're not as difficult at meal times. They tend to eat a wide variety of foods and not resist at meal times, and not crave those sugary carbs and foods, and unhealthful eating patterns as a result. So it's so important to get adequate sleep for families.
Yeah, I'm glad you said that because, in my Teach Me ADHD course, one of the modules we talk about is self-care activities that kids can take ownership of. So that way, when they get proper sleep, get proper nutrition for their brain, not just their bodies, but also and physical activity, we know that it can really affect their attention span, their moods,
Yes.
all of those things. So
Yes.
trying to empower kids to understand what they can do, start doing today
Yeah,
to really
absolutely. And it
help
will
themselves.
absolutely help their attention.
Mhm.
And I think a lot of times kids often get misdiagnosed with ADD, as a result of just poor sleep habits and poor sleep hygiene, not quality sleep. Uh,
Yeah. Yeah, is there any other, the introduction you talked about how, as a pediatrician, you have that lens. You're looking for other issues that could be causing sleep problems. I mean, is there anything in particular that you're like, "Oh, this is so common that, we need to be looking for it?" Because, I do have pediatric professionals also watching the show too. Any other things that might be missed or
I think the amount of sleep is crucial, and making
uh-huh.
sure children are getting adequate amounts of it. But also electronics.
Yes.
Electronics play a huge role, and kids. We our stomach grumbles when it's hungry. Our body is telling us when it's hungry, and our body's also telling us when it's tired and needs to go to sleep. But when we have those electronic devices, it's easy to push those cues. And signals aside, because what we're looking at is so engaging. And it's easy to say, I know I'm tired, but I'm going to just watch this one last, video, or I'm going to do the one last thing. And then that turns into another thing. And time eludes us, and before you know it, you're on the social media or the device for an hour and a half, 2 hours, 3 hours. And
Mhm.
then the body says, okay, if you're going to keep ignoring my signals of tiredness, I'm going to go into an alert cycle. It's that second wind happens. And then you're like, oh, I'm no
I can
longer
stay long.
sleepy. Yeah, I stay up longer. And then that cycle has to run through again, before the body is sleepy again. So I feel like a lot of times kids are missing that internal signal, especially the older ones are missing that internal signal. For younger kids, parents need to be mindful of those signals, and respond and get kids down before they get into that over alert and excitable state.
Yep.
But for teens and older kids and even adults, we have to listen to that internal signal. So, putting those devices away and having a hard cutoff time would be crucial for all families, and all providers to offer to their clients that, please turn your device off at least an hour before it's bedtime, and having a set bedtime, saying, even if it's a later bedtime, even if they're not getting their full 12 hours or 10 and a half hours or 10 hours or 9 hours, even if it's a shortened amount of time, just having that cutoff, and then cutting off the electronic devices at least an hour before to ready the body for sleep.
Mhm. That's so important, and, I'm guilty of that myself. It's one of the things that I'm working on. It's
Yes,
so easy to just kind of get sucked into that, and you're like, "Oh gosh, it's 1 o'clock in the morning. I really gotta get to bed." So,
yes.
yeah.
Yes, and phones now, you can use them as a benefit, and by setting alarms on the phone.
Mhm.
Sometimes, it's easy to ignore them too, but you can, try to, when you're thinking clearly, set multiple alarms for yourself. of when you want to start winding down, when the device needs to be completely turned off. And also for teens and younger kids who have phones now, putting it on do not disturb, or ideally just removing that device from the bedroom altogether. There's been a lot of research that shows there's this like pull, especially if you just wake up to go to the bathroom or wake up to have a sip of water. There's this draw to, let me check, did anyone text me, or send me a notification or an email. And looking at that device overnight stimulates the retina and can cause wakefulness and put you into another alert cycle, to where kids are then having difficulties getting back to sleep, and then it's impacting their attention, but also their grades and their mood and their ability to eat well and make good decisions.
Yeah. Do you know from those studies, do you know how, like, is there a specific length of time, like in the middle of the night when you sort of re-expose yourself, that it can do that, or?
Yes, I believe it's more, if you're looking at those devices more than a minute.
Wow.
Mhm.
Okay. Wow. So it doesn't take long.
Because it's normal for the body to wake up, for
Mhm.
adults, kids, everybody. It's okay, as your body's cycling through that circadian rhythm, to wake up at the end of those sleep cycles and kind
Mhm.
of toss and turn. Most people don't even remember that they're awake, and go back to sleep. But if when you go through those transitions, you have this like connection to the device that's sitting on your nightstand, like, oh, let me just check. It just takes a few minutes, less than a few minutes, to have that impact, and it can trigger a wakeful state.
Yeah. Wow. That's good to know,
Yeah.
because
I mean,
so.
look back at it, the times that you're like, oh, let me just check. And especially if you get sucked into something interesting,
Mhm.
it doesn't take long before then you're wide awake.
Yes, all the dopamine hits too. So.
Yes. And the light from the devices, the blue
Yes, the
light,
blue light. Yep.
it just it's just science, right? It
Mhm.
triggers the retina, it creates wakefulness, and it tricks the body into thinking it's time to wake up. So all
Mhm.
the hormonal shifts start to happen, like, okay, it's time to wake up, let's turn off the sleep cues and the sleep cycle, and shift to a wakeful cycle.
Yeah.
And then when you realize, like, okay, I'm still tired, and you try to go back to sleep, it's
It's
a lot more difficult.
harder. Yeah. One last question, because you said blue light. Do those blue light glasses work?
I like them, and now, like I said, phones are so great that they have those blue light blocking capabilities on the phone. So you can set
Uh-huh.
it into night light mode.
Mhm.
Most phones, devices, tablets, et cetera, have that feature. So if you don't want to go out and get glasses, just have that feature turn on, and you can set it to an alarm as well, and have it automatically come on at, if bedtime's 10 p.m. for an adult, and, have it come on automatically at 9, or if even earlier, so
Mhm.
that you can be off of the device by 9 if bedtime's 10. And that way, even as you're winding down and finishing the things that you need to finish, your brain isn't being triggered
Yeah,
to
that's a
thinking
great
it's still
tip.
daylight. Yeah.
Yeah.
So just have the night light feature come on your
Mhm.
device.
Just don't ignore that.
No, I mean, most phones will do it automatically. If you can
Yes.
just take that step of doing it and trying it out, and they have different intensities and stuff, so you can make it as, um, you know, it's red. It makes the screen red.
Uh,
So you can make it as red as you want, or less red, and play around with the intensity of it and see what works. And you can also decrease the brightness on your phone screen, and that can all be done and set up to automatically happen at a certain time.
mhm.
To
Do
think
you
about.
find when you work with, like, teenagers, specifically, or even kids, and you explain to them, like, the science, or does that engage them in a different way? Do you
It
find?
does.
Yeah.
It does. I think, there's a lot of information out there, again, like we were talking about earlier. But hearing it from a medical professional, and hearing that, hey, it's not that all screens are bad, or that you have to stop doing it altogether, but put these things into practice to make you more successful in your goals. And kids are, especially teenagers, are really tuned into like social media and what marketing tends to do. And, they don't want to be taken advantage of. And if they kind of understand like, hey, this is the science, this is what my brain needs, and I see what these social media platforms sometimes can do, or advertisers or whatever do to try to get me to keep on the device.
Yeah.
When they are educated, education is such key. Once they're educated, they're more able to kind of take that next step, and involving them in that choice and process makes it easier for them to conform. If you're like, no screens and, punishments all around and that sort of thing, it makes it a lot more difficult. But if you get them on board and educate them, they're more likely to get on board as well.
I love that. I love that. And so, lastly, what advice would you give parents? I mean, we talked a lot about different things just now, all good stuff. But if you had one take home point for the parents watching, what would it be?
I would say prioritize sleep. It's so crucial to every single aspect of a child's life. So there'll always be invites to birthday parties, activities, play dates, family events that go late into the night, celebratory occasions that, go into nap time. And all of these things are important to the family unit, as well as the socialization needs of the child.
Yeah.
But if they're regularly done in lieu of a nap time or appropriate bedtime, children accrue this sleep debt, which is really hard to undo and come back from. I mean, of course, you can always get back on track, but it just is harder. And it ultimately impacts their behavior, development, and their caloric intake. And if they don't establish good sleep habits in childhood, it impacts them into adolescence and adulthood, to where they're ultimately needing sleep medicines to get to sleep, and a lot more interventions to get to sleep, and it just deteriorates their life in the
Mhm.
future. So
Mhm.
prioritize sleep now, and it's never too late to start. So even if you're listening to this and you're like, my kid's 6 and not sleeping well, it's too late for them. It's never too late. Teenagers, adults even, it's never too late to change those behaviors.
It just takes some work,
It takes some work, yes.
but
And, if not myself, there are plenty of people here to guide you, to help get you back on track to good quality sleep.
Well, so let's talk about that. So, people are watching this and then they are like, huh, she's got some really great advice. I'd love to work with her. How do they get in contact with you? What are some of the services that you provide? I'll throw up your website here now so that.
Okay, yeah. So they can go to sleeplessanola.com/consult and make a free 15-minute call with me, and we can talk about their specific situation and how I can help them. There's 2 different packages, a silver package and gold package, and the main difference is the amount of time. So some families don't have that much to navigate and fix, and so the silver package for them would be ideal.
Hmm.
And some families who have a lot more needs and want to work on behavior, discipline, meal times, as well as sleep, the gold package would be ideal for them. And during the consultation, the free consultation, we'll kind of discuss which package would be the best for them, for them to see their goals and get results. So
Hmm.
if they want to go to the website, make a free consultation, that would be great. And I would be happy to talk to you and get you on a good sleeping journey. And then there's also a free downloadable tool, especially for toddlers who are having difficulties and stalling at bedtime. It's a checklist for parents to print out on what sort of things to do and how to get their child less stalling at bedtime.
I bet that's really valuable. That is a huge issue. So I'm glad you have a free download on that.
Yes.
And just to remind everybody, so your practice, you see patients from all over.
Internationally, yeah.
Yeah.
So I was working with someone in Ireland recently, in Spain, and then locally here in New Orleans, as well as all over the U.S. So everything's virtual. So it's either a phone consultation or a Zoom consultation, so that I can take a look at the room and make recommendations as far as that's concerned, as well as talk about the ideal sleep schedule and how to get the child sleeping through the night in a gentle and safe manner. So
Yeah, that is a plus with telehealth because you can see what their sleep environment is like and give
yes.
them, yeah, that's awesome.
Yeah, and like I said, because of all the information online, you think, okay, well, I'm supposed to have a mobile over the crib, or I'm supposed to have this, or I'm supposed to have this. And so this way I can take a look and offer suggestions. And so we're all on the same page and working with, and because of the virtual nature of it, I can be on the phone or on the virtual call with a grandparent who takes care of the child during the day, as well as the parents who take care of the child on the weekends and the evenings. And so everybody's on the same page of the appropriate thing to do for the child.
Yeah, that consistency is the key. So
Yes.
that's really amazing. Well, congratulations to you. I'm so
Thank you.
happy to have you on the show. It was really great chatting with you about why sleep's important, how to work with a sleep coach, some of those kind of little pearls that you threw in there about sleep cycles and blue light and phones. You know?
I feel like I have to always put that in there. It's
Yes, no,
we know
please.
it, even though we know it, it's, having that reminder is helpful.
Yes, even for me. Well, thanks for being on the show. And for those of you watching, next week, my guest will be LaFaya Mitchell. We're going to be talking about parenting social, emotional, and behaviorally challenged children. So please make sure to tune in, throw your questions out there. She'll be available to answer those. And again, if you have any other topics or guests that you want to feature on the show, please just send me an email or contact me on any of my virtual social media platforms because I'm everywhere. I'm always checking. I'd love to hear from you. And then last but not least, it is still time. You can still join my January book club. Dr. Lisa Damore, we're reading her great book about stress and anxiety and the epidemic of anxiety in girls. And she will be doing a Facebook Live book chat with me in a couple weeks. So please make sure to get that book and get reading because it's really, really good. And, like I said, we're here to talk about all of these things related to parenting and behavioral health. Thanks for always checking in and joining the show. It was such a pleasure talking to you today, Dr. Vyas.
Thank you so much.
Take care.
Bye.